Good morning and thank you for joining us. Teresa's not here for the YouTube session. I'll share our daily case counts. We now have a total of 16,608 cases to date, an increase of 16 cases from yesterday. 8 cases are close contact of a confirmed case, 7 are community acquired, 1 still under investigation. We now have a total of 162 cases that are currently active. 92 of them are variants of concerns, constituting approximately 57% of our total active cases, and 70 are non-variant of concern cases. 427 people have died with a COVID diagnosis. This is unchanged from yesterday. 13 cases are currently hospitalized with 5 people in ICU, and there are 7 active outbreaks across Windsor and Essex. 6 at the workplace and 1 community outbreak. With respect to vaccines, 256,079 residents have received at least 1 dose of a COVID vaccine, giving us a total coverage of 58.5% across all age group. 35,884 residents have received both doses, which is 8.2% across all age group. In total, we have distributed 291,963 doses of vaccine to Windsor-Essex residents. 72.2% of Windsor-Essex adults, that is 18 years or older, have received at least 1 dose of the COVID vaccine, and 10.5% of Windsor-Essex adults have received both the doses. Before I move to the epi summary, I want to let our viewers know that starting next week, we are moving to a Monday, Wednesday, and a Friday schedule for our YouTube live session. We will continue to share our daily case counts through our website, media release, and community updates. I'll now move on to our epi summary. So looking at COVID-19 cases in Windsor and Essex and Ontario. So overall, this is what the picture looks like in Ontario. We are starting to see that the third wave is almost getting to an end, but still cases, roughly around 1,000 cases are being reported every day in the province, which has improved significantly in the last few weeks, and the cases continue to decline everywhere in Ontario. Looking at our local rates, our local case rate 7-day moving average is also declining, and we are finally seeing some decrease in the last week. The week before, we were seeing that there was some stabilization of the cases that are happening, but last week we have seen some improvement, and our cases are actually going down. So putting those two pictures together in the same graph will give you an indication about the third wave, that how it fared in Ontario and in Windsor-Essex, and we can see the decline is evident in both Ontario as well as in Windsor-Essex. Looking at our week-over-week incidence rate per 100,000 population from week 18, 2020 to our current completed week, which is week 21 of 2021. And based on our most recent completed weekly case rate, we are now standing at 34.5 cases per 100,000 population. This is also another decrease from the last week. And just in the last 7 days, our weekly case rate, our 7 days case rate is 30.1 cases per 100,000 population. This has significantly dropped down from last week when we were above 50 cases per 100,000 population. So across the region in Windsor-Essex, across the southwestern Ontario region, everywhere we're seeing a decline. The case rates are declining, and we are pretty much stabilizing everywhere in the province. Looking at our wastewater surveillance data, and in the red line in the past week, we have seen that our wastewater surveillance data is also declining, which is a good sign showing that the overall burden of SARS-CoV-2 virus in our wastewater data is also declining. An indicator of what we are seeing truly in the cases in the community is reflecting in the wastewater surveillance data. So it's a good sign for the community that overall our active cases are declining, and we should continue to see further decline as more and more people get vaccinated. Please note that this, again, this wastewater surveillance data is still a part of a research study, and the data is still being evaluated and is subject to change. This figure looks at all the test and unique testing that was done in our region in Windsor-Essex. And in total, we have done 354,377 tests as of May 29th. And this is a complete week that ended on Saturday. For the week ending on May 29th, our percent positivity was 3.4%, which has decreased from the week before when it was 5.7%. This slide looks at the most recent 7 days worth of result of percent positivity. It doesn't incorporate any historical data, so this is just a point in time, last 7 days, what the percent positivity to look like. And Windsor-Essex had the 12th highest percent positivity in Ontario, sitting at 4.4%. This is lower again from last week when we were at 5.2%. This graph looks at the epi curve among school-age children, and our current 7-day epi curve is 5, which is higher compared to last week. Last week it was 4.3 cases, but please note that just because of the low number of cases, that these cases can fluctuate very quickly. So a difference between 4 and a 5 is not that much in the grand scheme of things, but it does show that there are younger children that are also contracting COVID in the region. Putting the two graphs together, school-age children versus overall we are seeing a decline. School-age children, we're seeing minor fluctuation, but those numbers are not that high or fluctuating that much to give us any indication that this is an ongoing concern. It's fluctuating between 4 and 6, which is what we have right now. Looking at our cumulative regional and provincial rates, not much difference from last week. We continue to be at number 4 with respect to our overall regional case rates of COVID. Drilling it down further with respect to municipality, starting all the way from May, which is last month, and what we can see, rate per 100,000 population, highest in the city of Windsor, followed by the town of Essex, and then LaSalle, and then moving further into Tecumseh, Amherstburg, Lakeshore, Kingsville, and Leamington. From a distribution perspective by municipality, in the last 7 days, 3/4 of our cases are coming from the city of Windsor, while the rest of the municipalities have a small share of data, a small share of cases overall. Similarly, in the last 7 days, a similar picture with 72% of cases coming from City of Windsor, and LaSalle, 8% of cases coming from LaSalle. With respect to age and sex distribution, we can see that in the last 2 weeks, we're seeing more cases in the younger population, and that's indicative of the vaccine coverage rate in the older population. So the higher the vaccine coverage rate, we are seeing a decline of cases in that age bracket. But since our younger population are still getting vaccinated and their coverage rate is increasing, so we are hoping that in the next few weeks or so, it will stabilize to what we expect to see or what we have seen throughout the pandemic. So right now it's higher in the last 2 weeks in the younger age group, but we anticipate that it would improve as we move further. From an exposure perspective, not a lot of difference. The only thing is obviously the case counts are going down, but the cases are distributed fairly evenly between the household contact, close contact, and the community transmission. So focusing just on the source of acquisition by proportion of cases, majority coming from the household contact, which is 39%, and then followed by the community, which is 36%, still 1/3 of the cases coming from the community, and then close contact roughly around 16%. The trend with respect to VOC is continuing to move in the direction of having the predominant strain circulating as the VOC. And in the last week or so, our proportion of cases that are VOC are coming close to 80%, which is significantly high, and giving you the impression are posing some risk and challenges to our community, because we know that some of these variants of concerns spread very quickly among population. So the continued ongoing measures, public health measures, are still important to maintain while we continue to vaccinate people and reduce the active cases in our community. With respect to COVID-19 hospitalization, we're seeing a downward trend across Ontario and in Windsor-Essex. And please note that this includes all COVID-19 patients in our hospital, those that are, and those that are not from Windsor-Essex. So it includes both. Similar picture in ICU, an overall declining trend. With respect to case fatality rate, what we're seeing is we have a slightly higher case fatality rate than the province of Ontario, but when we are looking at the long-term care home, our case fatality rate is slightly higher than the provincial average. Looking at our doubling time in Ontario and Canada, and in the past couple of weeks, we are seeing positive sign across everywhere, with the doubling time increasing in Canada, in Ontario, and similarly in Windsor-Essex as well. Looking at our most recent estimated median R0, it is right now at 0.84. This has increased slightly from last week when we were at 0.73, but continues to still remain below 1, which is giving the indication that the cases are declining in our community. So now switching gears and talking about the vaccine status and overall picture of where we are based on the data that data source. What we can see is we have now surpassed our coverage rate with at least one dose, even higher than the UK, and we are on track to surpass other countries, even including Israel as well, with our high vaccination coverage rate with at least one dose of the vaccine. We have already started vaccinating using our second dose, so hopefully we will be in a much better spot compared to our vaccination coverage, and clearly we picked up late, but we are on the trajectory of beating some of the other countries that have been so far leader in terms of the coverage rates with COVID-19 vaccines. This slide gives us a breakdown of the doses administered locally in Windsor-Essex, and most second doses were administered in February, but now we are seeing an increase in the second dose administered with the recently eligible individuals, and nowadays in some days, as we can see in the graph, that we have exceeded more than 5,000 doses administered in Windsor-Essex on a daily basis. We have had some days, especially the weekends, where the uptake is low, but overall we are doing a pretty good job with respect to administering doses. And when we are looking at the 7-day average, we are slightly over 4,000 doses administered. We are administering more than 4,000 doses across Windsor-Essex. And again, this is a 7-day average, including the weekends when the vaccine uptake is lower than the weekdays. From a coverage rate by age perspective, overall among 50 years and older population, our coverage rate is 82%, which is really good, and across the other age band, 80 plus, 94.5%, and then just showing the the gradient effect as we continue to move further below the age band, and partly it's because the time that each of these age band has been open and available, vaccine have been available to each of these band. So we are hoping that over the time it will stabilize and we'll have a fairly high vaccine coverage rate across Windsor-Essex. So this slide basically tells you what's happening among each of these age groups with respect to the uptake and the demand for these vaccines. And as we can see that our coverage rate in our senior population 60 plus has been saturated, and we are seeing a plateauing effect there. That means the new first doses being administered in that age band is getting slower, while we are seeing an increase in the other bands where with a sharp increase between the ages of 12 to 17, which has just recently opened, and continue to go upward. So this is a new graph that we have added, and basically it gives you a breakdown of those who have received their second dose, and the highest age band in this group is 80 plus, with 32.6% of our 80 plus population vaccinated with 2 doses. And again, this includes the people who are living at the long-term care home and retirement home as well. The other significant group that we are seeing is 17.6% in the 60 to 64 age band, and partly because of the AstraZeneca vaccine that they had access to, the earlier access, and then the most recent effort to give them the second dose of AstraZeneca or giving them the option of other vaccine. So overall, from a vaccine coverage with the full 2 doses of the vaccine in the 50 plus population, it's at 12.7% or 13%, if we can call it. And then from an overall age band, including all the age groups, it would be 7.4% that we have seen the coverage. So breaking it down, the coverage in the hotspot areas. So overall, our coverage is, and again, this includes all age bands, 57.8%, and then at the hotspot coverage, it's close to 52.5%. So we are still not there where we'd like to see, but we're not too far off. Some of these hotspots obviously have higher coverage rate than the overall coverage, but these hotspot neighborhoods continue to have a slightly lower coverage rate than the rest of the Windsor-Essex. So just giving you a quick background on where these vaccines are being administered, first and second doses, and as we can see, the most of these vaccines have been administered by the hospital-based clinic, both first doses and the second doses, and just because of the target population that each of us are serving. And then public health clinic are also picking up some of these cases, and then the pharmacy is doing an excellent job in terms of giving out these vaccines. So overall, giving you a picture of where these vaccines are being given out by each of these dates. And as we can see, the darker shade is the hospital-based clinic, and then followed by the public health clinic in the green, and then yellow in the pharmacy, constituting the bulk of these vaccine rollout in Windsor-Essex. From the vaccine type perspective, obviously our workhorse vaccine is the Pfizer-BioNTech with the highest number of doses distributed, followed by Moderna, and then by AstraZeneca. Again, similar data, similar information, 70% of the doses administered in Windsor-Essex is Pfizer, and 15% each of Moderna and AstraZeneca. Similar data. So in summary, the case rate in Windsor-Essex continued to decline overall, and even from comparing our data from last week to this week, we have decreased significantly. Our hospitalization and ICU continue to decline not only locally but also provincially. Our wastewater surveillance data has decreased in the past week, and aligning well with our current case rates. And our overall COVID-19 vaccination coverage rate is 57.8%, This is increased from last week, which was when it was 53.6%. Our second dose coverage rate in our 80 plus population is 32.6%, but obviously we just started vaccinating our 80 plus residents and hoping that that number will continue to increase. So from a monitoring indicators perspective, our most recent completed weekly case rate right now is at 34.5 cases, and just in the most recent 7 days, it has dropped down even further to 30.1 cases per 100,000 population. Our person positivity for full week is 3.4%, with some fluctuation in the most recent 7 days person positivity. Our R not effective has increased slightly from last week at 0.84, but is still below 1, showing that the cases are continuing to decline in our community, and we hope that it continues to fall in that trajectory. Thank you.
We'll now take questions from the media. Today we'll start with CTV. CTV? Any questions from CBC?
Yes, good morning. Dr. Ahmed, are you aware of any cases locally where someone experienced a serious side effect after receiving the AstraZeneca vaccine?
Not to my knowledge. We do get the adverse event following immunization reactions, and the reaction sometimes varies. Other than that, any concerns with WIT or any other significant concerns haven't been brought forward to my attention.
Thank you. And I noticed with regards to the vaccine distribution, the settings that people are getting those vaccines, one of the categories was other. Are you able to say what types of settings that would include?
That could be a pop-up clinic or some targeted clinic, depending on the specific population that they're serving, including some of the work that we have done initially with our paramedics. So those would be the other ones that I can see.
Thanks very much.
Any questions from CFTV?
No, thank you.
Any questions from Blackburn?
No.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Do you have an update on the number of people who have reported being vaccinated outside of Ontario?
Great question, Taylor. Thank you for the reminder. I do have an update. So we have a total of 2,182 respondents who completed the survey as of yesterday, and majority of them, and no surprise still, is the younger age population that are working there, with almost 1/3 of these individuals are continuing to be the healthcare worker.
Do you expect that there are a lot more people out there that just haven't responded to the survey who may have been vaccinated outside of Ontario?
I do. I think we know from, obviously there's no proper database that can give us a total number of people who actually work in Michigan. But according to an estimate, we know that that ranges anywhere between 5,000 to 6,000 individuals. And even from that standards, I would anticipate at least 60-70% of them should have been vaccinated. So our number should be close to 4,000 to 5,000 at the minimum. But again, we have done the outreach. We are trying to get the word out as much as possible so we can have an accurate understanding of how many of these people have received their vaccine. But it's a work in progress, and hoping that people will continue to put their information in. And as we know, the ministry is also working on a database that will have to collect all that information, even from people who have received the vaccine outside of the province or outside of Canada.
Thank you.
Any questions from AM 800?
Good morning. I'm just wondering, when the Premier was speaking, he was referencing in the school's decision about wanting to avoid a fourth wave. And we've been hearing that term multiple times over the course of the week. And so I'm just wondering, Dr. Ahmed, how concerned are you about the possibility of a fourth wave? And at what point would we start to see that happen if it did?
Well, great question. The way I see it, obviously, we have to fight with everything that we have against this pandemic. More recently, at our third wave, we basically did a pretty good job in avoiding it, and thanks to the high vaccination rate in our community, and thanks to the community for following the public health measures. And I know there have been instances where things could have been better, but overall, I think as a community, we have done an excellent job in doing that. So as much as the threat will continue to exist because the pandemic is still raging in some parts of the world, because of the connectedness, there will be more travel, there will be more opportunity for the virus to replicate, and every time the virus is replicating, there is a chance that it would turn into a mutant variant, which makes the vaccine ineffective or less effective. So the threat will always be there, and we can only prevent this threat by continuing to remember some of the things that we've been talking about all along. We need a high vaccination rate. So, and that means the first and the second doses, and we're hoping that we can continue as we speed up our second dose rates, we'll be in a much better spot. So we definitely want our community to get vaccinated at as much as possible at a very high rate. A very high vaccination rate would be the key part. And then even when things start to open up, we need to remember our responsibility. The key responsibility continue to be, if you're sick, stay home. And still try to maintain your physical distancing as much as possible. I know with your loved ones, maybe it would be difficult when things open up and when everyone is vaccinated or most of the people are vaccinated, that's fine. But when we are talking about having those large gatherings, when we're talking about people coming in from different places, you got to be careful. You got to be paying close attention to who what kind of physical distancing you're maintaining. So there are things that we still have to follow after this pandemic, but hoping that with a high vaccination rate, it may not be as big of a threat as it could have been. And I'm really looking forward to vaccinate our people as quickly as possible to even avoid anything in the future. So looking forward to it.
Just going back to something you mentioned in there, Dr. Ahmed, about the virus mutating and then the vaccines essentially becoming ineffective. So will people getting fully vaccinated now help to prevent that, or is that something that's inevitable?
Well, I think locally it would be preventable, and that's what the goal is. And if you recall, I presented many times the whole chain of infection slide, and basically what it says that the virus needs some kind of a reservoir. So the virus needs an individual or some human as a host to replicate and then find a new host before the person or the antibodies fight those viruses. The more people that are susceptible to this virus, and when I'm saying susceptible to virus, that means they are unvaccinated people. That means the virus would have an opportunity to jump from one person to another. But let's say in that jumping line, you have more people that are vaccinated. So even though virus can gain access to that person, but would not be able to infect that person, would not be able to replicate, would not be able to pass it on to other individual. So that way we will be breaking that chain of transmission. And the sooner that we break the chain of transmission, if there is no viable or susceptible host in the community, the virus will not have an opportunity to replicate. So that's the local situation. But when we are talking about international activity, when you have countries with very high active variant circulating or high number of active cases, because of all this travel, so even if our community is protected, if you're introducing new people in the community, then they will be bringing in those threats to the community that is already vaccinated and increase the risk. So it is not as simple right now that we just look about it locally. So yes, great, we need that local. That's the basic step. But we also need to think about how we are behaving internationally, what's happening in the international world, and if there's an ongoing threat, yes. But locally, we need to do our job. That's the basic part, and it would reduce our risk significantly to for any fourth or any other type of pandemic, especially linked with the SARS-CoV-2. There's new viruses coming out all the time.
Okay, thank you.
Any additional questions from CTV?
Yes. First of all, I just want to say on behalf of all of the local media, we really do appreciate these daily updates up to this point. I think it's been very, very helpful. Now that we're going down to 3 days a week, is this a good sign that the pandemic is winding down?
Definitely, that's how I see it. So the whole purpose of having these daily updates is to keep the community updated with the rapidly changing information, and as much as we try to share the information, but we know that with the rapidly changing information, it has not been easy for any of us. We have to stay on top of all the changing environment. What we are noticing right now is a stabilization effect with very limited changes that are coming down our way. So even when we started rolling out the vaccine, we know that there are changing guidelines. Okay, now who's eligible, who's next eligible. So we have done that part. Right now in Windsor-Essex, everyone is eligible. 12 plus, everyone is eligible. They can get the vaccine for their first dose. Second dose, yes, there's still some logistical issue that we are dealing with, but those are not as complicated as dealing with the first one. So we will be working on that. And even with the cases that we are seeing, it's stabilizing. The province has already given us a pathway of how the reopening will occur. So we'll share that information as soon as possible. So overall, I see that as a good sign that we don't have to continuously look for these ever-changing information, and hope that would stay that way. But any critical piece of information, we will definitely make an effort to get it out as quickly as possible. Our communication team has done an excellent job in staying on top of all these issues, and we'll continue to share the information that are critical and that needs to go out. If I need to come out and do an ad hoc type of update, I will do that.
Okay, perfect. And I just wanted to touch again on the Delta variant. What is the risk again here in Windsor-Essex?
So the Delta variant, obviously, it's we have seen 2 cases in here. So one Delta and one Kappa variant. They're all originates from the same B167 virus, and so we've just seen 1 case each of those. We know in other parts of the province, especially in Peel, they are seeing an increase in the Delta variant, and throughout the pandemic, it's almost Peel was served as like the canary in the mine because of the travel and everything happening in that area, and then spreading to other parts of the world. So they are seeing an increase in the Delta variant, and their concern is obviously, if we follow the previous trajectory, then it will spread to other parts of the province. So we will be at a risk because we know that people travel all the time. There's interprovincial travel that's happening, and it would pose a threat to our community. But with our high vaccination rate, maybe that risk may not be as high as in some other parts of the province. And the sooner we vaccinate our people, the better it is for us.
Okay, and last question. I know that the U.S. is set to provide 6 million doses to Mexico, South Korea, and here in Canada. Do we know what vaccines are coming here? Is anything going towards the mayor's efforts at the border to get vaccination there? What information do you have regarding that?
Well, I don't have that much information, but what I can tell you is the procurement of these vaccines and bringing any kind of or importing any kind of vaccine drugs, it does has some strong regulation, and Health Canada approves that, and then the federal government procures that. So there is a formal system and process. Everything comes through the federal government in that sense. So any additional doses that we are getting, it would be coming in through our federal government. And I appreciate the mayor's effort, and even myself and our hospital partners. We've been trying to get some of these doses that are not being used in Michigan, but there are some real challenges that all of us are aware. And for me, I like to stick to the task. I want these vaccines to come to Windsor-Essex so that we can distribute it, and we'll continue to work on it, even quietly, because you don't hear me talking about it doesn't mean that that the conversations are not happening. And at the right time, if it's all aligned well, we'll be able to do that. But right now, the task on hand is, for me, give out the vaccine that we have and continue to advocate and look out for additional doses that we can get for our community.
Okay, thank you.
Any additional questions from CBC?
Yes, Doctor, I just got a media release saying that the province is accelerating second dose booking, and that people who are 70 and up will be eligible to book in the provincial system as of Monday. I know that this is brand new, but is that something that you anticipate we would be able to do locally as well?
So I haven't seen that, but it was not unexpected. We were expecting that, and we will share our local plan based on what the province is sharing. So stay tuned. Later today, we'll send how it will affect our vaccine rollout for second doses. Short answer is we'll try to align as best as possible with the province, but stay tuned for the details. It will come out later today as soon as we are able to make sure that what is in the news release and how it aligns well with our local priority.
Thank you. And how was the response to the pop-up yesterday?
So great question. I think we have got a pretty good response, and I'm just looking at the number that was shared with me this morning, and we 352 people that attended the Essex pop-up clinic, so which is pretty good. We, as Teresa mentioned, that we try to target roughly around 400 people in that pop-up clinic, so we were pretty close. And I think a great response from the community, great partnership with the municipality, Town of Essex, and every one of us are trying our best to serve the community in the best possible way for the vaccine rollout. So thank you to the municipality of Essex for hosting that clinic.
Thank you.
Any additional questions from CFTV?
No, thank you.
Any additional questions from Blackburn?
Yes, just to follow up with some of Taylor's questions about people who have been vaccinated in other parts of the country or in other countries. Do you know if they're where the talks are to have them formally recognized or to get their registration locally for them to be part of the coverage data, just so that they have local recognition that they have been vaccinated?
Yeah, so active conversation, and the imminent change that will be coming into our COVAX system that would allow us and others to register these people to the system. For those who are looking to get their second shot in Canada and they've received their first shot outside of Canada, and also for those who may already completed the series but want to get registered into the system that they've received their vaccination. So some logistics in terms of how that would that would look like? Would people have the opportunity to go and self-register, or would be that would happen through their healthcare provider? So some of the details are still we're waiting on, but it is imminent. It will be coming soon to make sure that we have a much better comprehensive understanding of what these where these are, who these people are, and what the coverage rate is there.
Thank you.
Any additional questions from the Windsor Star?
Yes, Doctor. Do you think the 80-plus group has had enough time to book their second dose appointments? I know during the first doses, there was a lot of talk about not wanting to rush those individuals. So now that we're opening it up to 70-plus on Monday based on the provincial release, what are your thoughts on that?
Yeah, no, I think we really got a good response from our 80-plus in terms of registering them. As I reported, we are vaccinating approximately 4,000 people every day on a 7-day average, and in some days we are vaccinating 5,000 people. So that's a lot of vaccine that we are administering and that we are giving out. So the response was good from the 80-plus, but obviously we want to make sure that they have a good opportunity to register, and there are some opening that always that we are seeing in days, and as we are continuing to plan, we want to make sure that we have people registered for that. So it may not necessarily be a bad idea, but if there are any concerns, we'll obviously go back and look at it and make sure that people are not falling through the cracks, and they have ample opportunity to get their second dose.
Based on that, is it safe to say then that it's a good thing to open it up to 70 plus because they will be able to fill holes that are currently being left open in the booking system?
That is correct, and I quickly looked at the media release. Obviously, we were expecting that, so maybe I can share some of the details that what it would look like, and then we'll follow it up with the media release just for clarity. So what the local plan would look like based on what the ministry announcement is. So the ministry will open up the booking for as of Monday, which is June 7th, for people who are 70 years and older, or people who have received their vaccine before April 18th. So we are taking slightly a modified approach to that, as opposed to opening it up all the way up to April 18th, because that's a large number of people who received our vaccine locally. So what we will be focusing on is anyone who has received their vaccine prior to March 31st. So anyone the month of March or before, anyone who has received the vaccine, they would be able to book their second dose appointment through this system, which we will open it up tomorrow morning at 8 o'clock. And then anyone who is 70 years and older, regardless of the month of March, they should be able to call in and register their second dose appointment using our booking system. So that will be the local rollout, and we'll make sure that we continue to share that information with the media. So one last thing about the AstraZeneca piece. So anyone who has received AstraZeneca, they should also have the ability to book their second dose starting Monday, which would be June 7th, after the 12 weeks interval for their mRNA vaccine, if they choose to switch to an mRNA vaccine.
Doctor, what is the interval for second doses for, say, somebody who's 70 years old but got it after that March 31st date?
So a minimum interval of 28 days that we are looking at, but hoping that majority of the people who have been vaccinated before March 31st, they would be at a higher interval. And again, there are some preliminary data that suggest that even extending some of these interval was actually a good decision, because it generated a better immune response just because how the vaccine worked. So it's not necessarily, and I know there are some people who are rushing into getting the second dose. Rushing into second dose doesn't necessarily mean that it's a good thing, because the body does have the active immunity at that time and then getting the second dose at the right time, it helps to boost the immunity in a way that is much more lasting. So no need to panic about getting it right at the 28 days, but for 70 plus with may or may not have some kind of immune challenges or immunocompromised issues, so they will be able to get their vaccine exactly after 28 days or at the minimum at 28 days, and should be able to book.
Thank you.
Any additional questions from AM 800?
No, thank you. Have a great weekend.
Thank you, everyone.
Thank you.